What does Plan N cover? In this video, I'm going to show you all the benefits and go over exactly how it works. I'm Jared with MedicareInc.com, giving you money-saving tips and strategies to maximize your Medicare benefits. Like other Medigap plans in most states, Medicare Supplement Plan N offers standardized benefits. Now this means you get the exact same basic benefits for Plan N no matter where you live or which insurance company you choose to purchase the policy from. And that means the name of the insurance company is irrelevant. A Plan N is a Plan N no matter which insurance company sells it. Now generally, Plan N costs significantly less than other Medicare supplement plans. So you're going to see huge savings with that lower monthly premium. And one of the reasons Plan N premiums are so low is because there are some out-of-pocket costs when you need care. But those out-of-pocket costs are nominal compared to the benefits Plan N offers. For example, Medicare Part A, which provides benefits if you go to the hospital, will cover things like skilled nursing, blood transfusions, and even hospice care. Before performing these services, there is a Part A hospital deductible, which is $1,408 in 2020, and a coinsurance of 20%. Medicare Plan N covers these out-of-pocket costs for you. With Plan N, there's a $50 deductible if you go to the hospital, or if you need any of these services mentioned, but that $50 fee is waived when admitted as an inpatient to the hospital. Plan N will also cover you for an additional year, 365 days, worth of hospital benefits once your Medicare coverage runs out. You're even covered up to 80% for foreign travel emergency when you travel outside the US. Now keep in mind, this emergency coverage has a lifetime limit of $50,000. Plan N will pay 80% of certain medically necessary emergency care. There's a $250 deductible for the year that you would need to meet before Plan N would cover you in this scenario. So if you're out of the country, going on a cruise, visiting outside the US, Plan N offers you that peace of mind when traveling abroad. Plan N is the only plan that has a copay of up to $20 for doctor visits, such as your primary care or specialist. As long as the doctor you're visiting takes Medicare, you're covered. And here's how that works. Medicare Part B will cover 80% of your approved bill. Plan N will cover the other 20% after you've made a $20 copayment. Also, if it's your first time seeing a doctor for the year, there is an annual Part B deductible that will need to be met. Plan N does not cover this deductible. You may be asking what this annual deductible is, and it's simply that, an annual deductible. It's a once per year annual deductible, $198 in 2020, that's paid to Medicare for services or costs that fall under Part B. An example would be the first doctor you see during the year will trigger notification to Medicare. Your doctor's office will send you a bill asking to collect that annual deductible, and once your doctor's office has received your payment, it is then forwarded to Medicare. Now your annual deductible has been met for the year. So it's not something your Medicare Supplement Plan N or doctor's office charges, it's something Medicare charges but is not covered by Plan N. It's also important to understand this deductible is annual, meaning you only have to pay for it once per year when you need care that falls under Part B. You won't be charged this deductible every time you see a doctor. This deductible also resets each year, but if you don't see a doctor or don't need care, you can avoid paying this annual deductible, and that just means more savings to you. Lastly, Medicare Plan N does not cover any Part B excess charges. Sometimes doctors and other healthcare providers can charge 15% over the Medicare allowable charge for certain services and procedures. This is known as the Part B excess charge. Here's an example. If you need care and the Medicare allowable charge for a procedure is, let's say, $100, your doctor or specialist could add 15% to your bill, totaling $115. In this situation, Medicare would cover 80%, your Medicare Supplement Plan N would cover the other 20%, and you would be billed the remaining 15%, or in this scenario, $15. But the good news is not all doctors, clinics, or facilities charge this excess. It's estimated that a very small number, around 2%, will even charge this excess, so it's really easy to avoid. Also, some states do not allow excess charges. States like Connecticut, Pennsylvania, Massachusetts, Rhode Island, Minnesota, Vermont, New York, and Ohio. If you happen to live in one of these states, be sure to speak to one of our licensed agents so we can help you with your specific situation. But the best way to protect yourself from any excess charge is to only use physicians who accept Medicare assignment, and that's around 98% of all doctors and clinics nationwide who accept Medicare. So just remember to ask your doctor or clinic or lab whether or not they bill this excess charge before you make an appointment. So again, the only out-of-pocket costs you may see under Medicare Plan N would be a copay for doctor or hospital visit, your annual deductible, and a potential 15% excess charge, which again is easily avoidable. Thanks for watching, and if you have questions about your Medicare Supplement Plan, we're here to help. Our contact information is below. Don't forget to subscribe and hit that notification bell. Thanks again for watching. We'll see you next time.